Here's a question. Do you know your calcium score? Well, knowing that number could help prevent life-threatening heart conditions.
But few people know a test to determine it even exists. Dr. Aman is a cardiologist with UT Health Houston and Memorial Hermann, joining us live to tell us more about it. Welcome to Houston's Morning Show. Tell us about this calcium score screening and why isn't it talked about more?
Hi, thank you for having me. So imagine a test that you can do within minutes that doesn't require any IV or contrast, and it could predict your risk of having a heart attack. A coronary calcium score is basically a CT scan of your heart that can look at plaque through a software and actually give you a score. If you're above 40 and have a strong family history of heart disease, high cholesterol, or diabetes, this is a good test to assess your risk of having plaque. The best score is 0, and if your score is 0, your risk of having a heart attack over the next 5 to 7 years is really, really low.
Okay, so what is this process like? Is this something that you get done by your primary care physician, and what exactly happens?
So yes, you need a referral from either your primary care doctor or your cardiologist, and you go to your CT scan. Basically, it takes no more than a few minutes. You don't, like I said, require any IV, and within a few minutes, you get the scan done through a software. It picks up any plaque, and if the score is 0, great.
And you mentioned problems like perhaps a high cholesterol or diabetes. Do you need other indicators to even consider getting this test, or is this something that could really give people an overall idea of their cardiac health?
Right. So, like I say, if you have diabetes, if you've been a smoker, if you're overweight or have a sedentary lifestyle, most of this studies have been over the age of 40. But in cases of a strong family history of high cholesterol, you can get it done below 40 as well. It's best to discuss with your cardiologist or your primary care doctor to see if you're a good fit for this test.
Okay, and is it covered by insurance, or what would the cost be?
So some insurance do cover it, but for the most part, it is a screening test. It's usually around $100 to $200, depending on where you're getting it done. Prices may vary.
And then once you get this test done, is it something that you know those numbers are going to hold fairly steady for years to come, or when would you need to think about repeating that test?
Yes. So in some select cases, like diabetics, you repeat it about 3 years, and otherwise you don't need to really do it in the next 5 to 7 years.
Okay, thank you so much for your time this morning. We really
appreciate it. Thank you for having me.
Something I had not thought about yet.
I know.
Thank
you for having me.
Not one you hear about all the time.